Nice to meet you all. My name's Raymond. I'm a public health doctor working at Luton Council. Thank you all for coming. Today we're looking to talk about and launch our Asthma Friendly Schools program. This is something we're really excited for and think it'll be really, really useful to the children of Luton as well as the schools of Luton. I will talk lots and lots and lots about it in about 20 minutes or so. You'll get to hear lots of very exciting, I promise you, details. But in the meantime, I think what we will start off with is a short presentation from Liz Melody, who's one of our nurses at Cambridgeshire Community Services, who help us provide a lot of community asthma services. And then followed by that, I'll give a few more details on asthma friendly schools, what the benefit of it is, why we decided to go ahead with it in the first place, and how you can get involved. Following that, my colleague Izzy Malik, who works in public health with me at Luton, she will discuss the Protecting Little Lungs initiative that we're running here as well, which we've integrated into the Asthma Friendly Schools program. And following that, we have our lovely guests, Mandy and Pam from Stopsley High School, who'll be able to give us a rundown of how Asthma Friendly Schools was successfully piloted and implemented at Stopsley. And then following that, we'll have some time for questions and answers. At the moment, I'm just to be clear with everyone, the session will be recorded and we'll be sending out to some schools who wanted to attend but were unable to attend at the current time. So if you have any very personal or sensitive questions that you want to ask, I suggest that you ask these once recording's over. We'll pause that for the Q&A session, or you can email us separately and I will make sure that our email is plastered all over the place. Finally, last bit of housekeeping is that I believe we have the chat enabled. You can ask questions in there if you like. Alternatively, we have the Q&A function, but either of those will work for you. Then do what is best, and we'll try to answer questions in the chat as we go along. Great. So over to you, Liz.
Do you want me to? I'll just start while Tara's setting up the slides for me. I'm not very tech savvy, so I'm getting assistance. So my name's Liz Milady, and I'm a community children's nurse. And myself and my colleague Sam Slaney work in Luton and Central Bedfordshire, and we look after children in their own homes with respiratory conditions, including asthma. And asthma is the commonest one. We work alongside the consultants at the L&D, the 3 respiratory consultants there, and we tend to look after children with slightly more complex asthma because obviously it's so common. There's so many children with asthma. We tend to concentrate on the ones with the more complex needs. So the presentation is all about asthma. So basically, these are the things that I'm going to cover today. So the facts about asthma: what is it? The causes, the signs and the symptoms, really relevant for you guys. The impact on learning, what triggers asthma symptoms, control of asthma, the medications we use, how we assess how good asthma control is, and how to handle an asthma episode, and then just a little bit of information about the future. Okay, so in your class of approximately 30 children, if you think an average, there'll be 3 in each class. So 1 in 11 children in this country have asthma. What is asthma? So it's chronic and it's variable. It causes inflammation in the airways. The variable is quite an important thing to know. So a child can be absolutely fine when they go to school in the morning, and then they may develop symptoms at any time throughout the day. It may be something that's at school that's triggered it, or it may be just would have happened anywhere, but it is very variable. So just because they're okay one minute doesn't mean they're okay the next. It causes recurring episodes of breathing difficulties. It can be life-threatening. It can occur at any age. It's not contagious, so it's incurable, but it can be controlled. So the common asthma symptoms. Oops. So shortness of breath, wheezing, tightness of the chest. Sometimes children don't always explain that symptom very well, but you'll recognize it by the shortness of breath, and you'll be able to hear the wheezing, coughing, waking at night or early in the morning. If the child's got any of those symptoms, that's a marker of poorly controlled asthma, and it means we need to look at things and see what we can do about that. So there's different types of asthma. You won't need to be aware of all these different ones, but just sort of give you an idea. It can be exercise induced, it can be seasonal, it can be allergic. There's all sorts of different ways of describing the different types. It can start in childhood, it can start in adulthood, it can stop and start. It's quite variable. So the management is normally a preventer inhaler, which the child uses every day. And that helps to, so that doesn't relieve the symptoms, but it helps to stop them getting symptoms by reducing inflammation in the airways. That inhaler should be at home, and that's what the parents should be supervising the child to have. It's usually twice a day. The reliever inhaler, the blue one, is what they will probably carry at school and that you'll have in school. There is a new type of treatment that's becoming extremely popular called MART, which might confuse schools for a little while, but we're always available to offer advice, where the child is not using a blue inhaler, they're using a little turbohaler, and they can use that one turbohaler for relief and prevention. So it's a little bit confusing, but like I said, we're here to help. Generally, primary school age children will still have the blue inhaler. They also should all have a written action plan, and that includes information about how their asthma affects them and how to manage it. And they should be having regular asthma reviews with their GP or the asthma practice nurse. So these are some of the signs that a child's got poorly controlled asthma. So feeling tired all the time, especially if they're coughing at night and that's disturbing their sleep. Absence from school, obviously that can affect their education. Disruption of planned activities with friends and family because they've got to go to the doctor or A&E or urgent care or wherever they need to go to. Stress, anxiety, low mood. It can cause delays in growth or puberty in some cases. So if it's poorly controlled, that increases the risk that they're going to have a severe asthma attack, which can be life-threatening. So what happens during an asthma attack? We've got two airways there. The one on the left is the normal airway, and as you can see, the blue lines around the outside of the tube are muscles, and they're nice and relaxed. And the actual lumen of the tube that is nice and big and open. There's lots of room for air to sort of swish in and out as the child breathes. The airway on the right side is an airway of a person with asthma. So there's lots of things happening there. The airways is narrowed and it's got lots of thick mucus in the way, it's swollen, and there's not enough room for the air to swish in and out. The preventer inhaler, the one the children take at home twice a day, that is the job of that one is to get rid of all that swelling and mucus, so that if the child does meet a trigger, they're less likely to have an asthma attack. The blue lines around that asthma, that airway are tight and they're squeezing the airway. So what the blue inhaler does when you give if the child's got symptoms, that relaxes those blue muscles so that they're not squeezing the airway and making it even more narrow. So these are just different types of inhalers. We've got the blue ones, that's obviously for relief. It's quite quick to act. It acts in a couple of minutes. As I've said, it relaxes the muscles. It can be a lifesaver, reminding children, parents, whoever, to always carry their blue inhaler. If they, what sort of the guidance is suggesting is that if they need to use that more than 3 times a week, that the asthma is not as controlled as we'd like it to be. And just be aware when you're using inhalers in school that you just need to check expiry dates and etc. Preventer inhalers, those are the ones that I said are normally taken at home, and they get rid of that swelling and that mucus and the inflammation to try and make the airway more open. They contain a steroid, which helps reduce all that inflammation. I won't go into all the medical details of everything. So this is just another type of inhaler. You don't really need to know a lot about it, only that some children will be on an inhaler. Again, it's the one at home, the twice a day one, but it will have a long acting version of the blue one in it and a steroid to get rid of the inflammation. But again, they shouldn't have that in school. I don't think you need to. This presentation, you have to excuse me, I use it for teaching lots of different people, so not everything's relevant. So the types of inhalers, we've got metered dose inhalers. Those are the ones, that's like the blue one, the salbutamol or Ventolin, that you put into a spacer device. I'll show you pictures of spacers in a minute, and that's providing the relief for children. You don't often see children with breath activated inhalers, but you can get them. The dry powder inhalers, yes, they're, like I said, one of them, the turbohaler, is becoming more common, and you may see children at school with not the blue inhaler for relief, but they're actually using the same turbohaler for relief and prevention. So these are the triggers. I've got a couple of slides here showing all the different triggers just to sort of make you aware. Obviously, you're probably aware that if a child gets a cough or a cold, then they're much more likely to get symptoms from their asthma and a worsening of their asthma. Sometimes some children exercise can induce asthma symptoms, but if it does, we need to see them and try and get on control of that. And there's lots of different ways we can do that. It's not, we want children with asthma to exercise, though. We don't want them to not exercise, and we don't want them to not do PE. So we need their asthma to be better controlled so that they can continue to do that. Obviously, cold, damp, changes in the weather. Sometimes emotions, physical expressions can trigger symptoms. Obviously, sometimes animals, pets, dust mites, mold, indoors and outdoors. In the summer, pollen from the trees in the spring, tobacco smoke, scented products, strong fumes or odours, and you've got outdoor air pollution, which is big in the news at the moment. So most children with asthma should be able to have an active life without symptoms. It includes, like I said, participating in sport, sleep through the night without having asthma symptoms, and prevent and reduce the amount of exacerbations that they have. There we've got a Olympic medal winner who has asthma. So asthma is controlled by following their written asthma plan, reducing or eliminating exposure to triggers, encouraging and using and supporting the use of the medication as prescribed, and lots of time spent with parents explaining the different roles, what the different inhalers do and how important it is for them to take their preventer every day. This is not really relevant for you. This is some of the things we do to review children, how we know whether they're doing well or not. This is a picture of an asthma plan. It doesn't have to be this one. That's the front and back. On the asthma plan, it will have what triggers the child's asthma, what medication they're on, what to do when. It's like a traffic light system. So if everything's green and it's okay, they take the daily medication. The amber is what happens when it's getting a bit worse. What should you do? And then the red is, oh, things are really not good. We need to be getting them reviewed or calling for help. You can download any of these asthma plans on Asthma and Lung UK. They've got really good asthma plans for any age group and for any types of inhalers. This is a school asthma card, again from Asthma and Lung UK. You can ask the child's medical professional or even the parent to fill in. It's got things on it like how do you recognise when my child asthma's getting worse? Sometimes that's really useful for sort of nursery, primary school age children that may just sit down and go very quiet and are not very good at putting their hands up and asking for help. These are all the different spaces. I'm not quite sure what schools you're from, but primary school children should have a green spacer with a mouthpiece. Once they get to 5, they are too old for the yellow spacer, which is for toddlers and nursery children with a mask. So primary school children, green air chamber, and high school children, blue air chamber. both with mouthpieces, not masks. I'm not going to show that because that is all about younger children on it. But if you go to Asthma Lung UK, there are loads of really brilliant videos for schools, including how to use every different type of inhaler that's available, and there's a lot. When you're giving a child their inhaler in school, you should always, even high school children, should be using a spacer. That slide explains why. If you don't use a spacer, research has shown us that the amount of medication that gets into the lungs is very small, as you can see on the left. And most of it is sticking in the mouth and the throat, some of it even in the stomach. If you use a spacer device, as you can see, the slide on the right shows you lots of medication in the lungs where it should be. So this is, I don't want to take too long with this talk, so I'm not going to read every single one of those in. But again, if you go to Asthma Lung UK, there's really brilliant demonstrations for every type of spacer and inhaler device and how to use it. I think somebody else is going to talk about how you can become an asthma-friendly school, so I won't go into that. Thinking about the school environment, that's important. So it should be kept free of the common allergens. So house dust mites, so that's obviously damp dusting, and I'm sure all your schools are immaculately clean. Viruses, damp, mold, air pollution, all that type of thing. Obviously, warm-blooded pets. I think that doesn't really exist in schools these days. Chemicals in science. Students have got specific triggers. Make sure that's all sort of looked at and sorted out. Cleaning and grass cutting. If a child's allergic to grass, then obviously it would be better if they don't play out just after the grass has been cut. Managing asthma in school. So staff should be trained to recognise an asthma attack and how to respond. Somebody needs to stay with the child. No child should ever be sent to get their inhaler when they're having difficulty breathing. Obviously, emergency service parents will be informed, and then whatever your school policy is as far as going to hospital. So what to do in an emergency, just quickly, call for help. You don't want the child to lie down, to keep them sitting up. That's a better position when you're struggling to breathe. Keep calm. Take one puff of the reliever inhaler with a spacer every 30 to 60 seconds, up to a total of 10 puffs. If the reliever inhaler is not helping, call 999. If the ambulance has not arrived after 10 minutes and the symptoms are not improving and the child's getting worse, then you just repeat, and don't worry about if you've gone over your 10 puffs. You need to keep you help the child as much as you can while you're waiting for help. I'm not sure that this is really relevant for you, but there's lots of things going on that hopefully will improve care and treatments for children with asthma. And those are some resources. Like I said, Asthma UK is absolutely brilliant, and I would always recommend that you go to that for advice and different learning tools, plans, anything that you might need, demonstrations of inhalers, it's all there. Okay, any questions?
As Liz has just said now, so we at Luton Council are aiming to roll out the Asthma Friendly Schools program across Luton. This is an initiative that we're starting from today, so hopefully all the resources should be available on our website, and I'll walk through that as we get to it. But if you do have any queries that you want to get through, the email is here. It's asthmafriendlyschools@luton.gov.uk. And I run this inbox, as do some of my colleagues here in the call, among others. So if you email, we'll be able to contact you. We'll be able to reply to you and give you any further information that hopefully we can help with. So I don't need to do this slide, I think, because Liz has given a very detailed and very, very quick and efficient rundown of asthma, and I think mine is even quicker, so I think we can skip this one. But I think the main takeaway, as we say, is that with the right treatment and support, people with asthma can live normal, healthy lives, but without it, it's quite debilitating, and it can be a really serious life-threatening condition. So it's really important that we, get things right for asthma. it's one of those conditions that if you have good control over on your in your day-to-day life, you pretty much would never need to go see the inside of a hospital. Um, and the thing is that in Luton, we could do so much better with regards to stopping people from getting into hospital. Um, in children, especially, we're amongst some of the highest rates of asthma admissions to hospital. For example, 15 out of 20 wards in Luton are above the national average for asthma-related hospital admission. I mean, out in Beach Hill, for example, it's 6.5 times the national average, 900 versus 150-ish. Um, which I think is something that we could all do so much to improve. And I don't think anyone wants to see children sent to hospital this much. Um, and the problem is, is that asthma is a all-encompassing illness. Being unable to breathe makes it difficult, no matter where you are, at home, at school, out with your friends. And so schools will experience a lot of the knock-on effects from being having really poorly controlled asthma and being in hospital. Some data that we've got actually, when we collaborated with the Luton and Dunstable Hospital, we found that of the 70 or so schools in Luton, 52 of them had one pupil in A&E, at least one pupil, mind you, for their asthma last winter. And that's just over this 3-month period. So I think we can all say that 52 schools is a huge number of schools to have someone in hospital for. Um, and so if we can stop that or at least improve things earlier on, then less children have to be sent to hospital, means that they get to benefit more from school, they get to be more active, and they get to have healthier lives further down as they progress. So I think it's really, really important that we think about how do we improve day-to-day care for our children in Luton, and how do we stop them from getting into hospital or reaching the stage where they need to go to hospital for their asthma. So that's kind of some of the thinking that led to the implementation of the Asthma Friendly Schools program. Um, this is essentially a free initiative that we're running to certify, primary and secondary schools as asthma friendly. It's got 30 standards, but these broadly fall under categories of, having a written asthma policy, a register of pupils with asthma, management in the day-to-day and emergency with staff that are trained to do that, as well as keeping smoke and vape-free entrances at all entrances into the school. And now this is a tried and tested program. They run it in London, they run it in Derby, in Suffolk, amongst many other places. So it's tried and tested, and we know that it's very well received across the country. Um, the 30 criteria, it sounds like a lot, but fundamentally, most of these criteria revolve around these kind of areas and can be hit multiple times at once. And you may already be doing some of these. So we think that it's a really efficient accreditation program as far as things go. I've just put a kind of category hierarchy chart of all the subsections of the categories and the criteria to kind of understand how it fits. But essentially, most of it sits around having robust documentation, knowing who has asthma essentially, and then getting the permissions to, look after them, whether that's you know, in a case of an emergency, having parental permission to administer inhalers, or recognizing when things, if for example you're storing the inhalers, recognizing when the inhalers are going to expire. But also alongside that is having the actual training in order to be able to do that. There's no point having the knowledge if you can't act on it, for example. So we are hoping to provide some training to schools, yes, on day-to-day asthma, but also on how to use emergency kits and so on and so forth. Um, And the other final thing about that is that it's really important that we keep smoke and vape-free school entrances because secondhand smoke is a huge risk factor for asthma exacerbation, and being sent to hospital does certainly doesn't help. Um, and so it's one of those things that we're already doing some work in the council for, and we think it's really important that we integrate these kind of things, build it all together. And if you've already been involved with keeping your school entrances smoke and vape free, it's a really easy thing to start getting accreditation for. Um, so I've talked a bit about, what we want to offer schools. I think the fundamental thing is that we really want to make it as painless as possible. Um, so it can be an independent process for you as you want. If you feel you've already met all of those criteria, for example, you can submit an application to become accredited right away. But if you don't have all of those, and some of the more let's say boring parts of it, such as writing out a whole policy, or making all of those mundane templates for letters, etc. We are happy to provide some pre-written materials for that, which will be listed on our website. We've got ones for the school policy, an example register, a record sheet for inhaler use to include with the emergency kit. We've got examples for requests to parents to provide personalized action plans, um, example letters to the pharmacy to say we'd like to buy this many inhaler kits. But alongside the written stuff, we also are hoping to give training to staff. So with our partners at NHS Bedfordshire, Luton, Milton Keynes, we've got some free online training that's available, and we can coordinate that for you. So if you email us, we will be able to get you registered for this for free. It's CPD as well, so it can count towards your professional development requirements, and is only an hour long, so it doesn't take very long. But it's quite well received. I don't know how much value you put on course reviews on the provider's website, but everyone I know who's done it has said that it's actually very useful. Um, and then alongside that, Liz and her team at Cambridgeshire Community Services has also offered to do some educational mornings on asthma with either the staff or parents. If because e-learning is great, but it doesn't quite match the same as having that discussion in person, answering those questions that you might have, and kind of getting the details clear. So alongside that, though, we also want to be able to provide some physical materials. An example that I've got here is things like school gate banners to keep, clear signage for smoke and vape-free entrances. Um, and so we're happy to try organize as much of this as possible, make it as pain-free as possible for schools to become asthma friendly. And so all we ask for is your willingness and your time to get involved. And speaking of time, the rough kind of timeline of things will depend on the school and how much is already in place. But hopefully, we kind of reduce as much of that administrative burden as possible. Essentially, the way it should work is that the school will find out about the program. You are already leading on that, so that's excellent. And you'll contact us. Again, you don't need to contact us. It's a fairly independent and can be completely automated if you want. But we suggest that you do because free stuff is great, but also because we have the asthma friendly schools who've achieved accreditation listed on our website. So if you are looking to do that, it would be good that we can put you on our website afterwards. Um, but then you can access all the e-learning, the training in person, the online resources, and then implement that, train your staff, get the emergency kit, everything like that. And once all the standards are achieved, we have it so that there's an online self-certification form on the Luton website. So this means that you don't have to ask us. There's no email back and forth. It's a trust-based self-certification. So you'll go onto the web form, you'll answer all the questions, and if there's an area where it doesn't feel that you've met the criteria, you wouldn't be able to continue with it, but or continue with the form. You can continue with the achieving the criteria. And then once you've done that, it will automatically send you a completed and signed certificate showing that you've achieved asthma friendly school status to the email registered when you submit the form. But as it's a trust-based exercise, we really do ask that you do it with honesty and you're all professionals. I don't need to say this, but we will also do a regular randomized audit, which may be in person, just to make sure that all the documents are being kept up to date, or the emergency kits are there and nothing's expired, etc. Um, as I said, there's a few domains to the accreditation process. I appreciate I haven't really gone into a huge amount of depth on what each of those are, so I will briefly cover what each of these are. But if you want a bit more detail on what each thing is and the responsibilities behind it, I suggest that you go on our website, which I'll link to you later, and have a look at the kind of individual parts of it. So number one thing that we've got on there is the asthma champion, and I think it's a fairly self-explanatory role in that it's a nominated member of staff who, or it can be multiple members of staff who take the lead in implementing the policy. That doesn't mean that, I'm going to ask that you chase down every single member of staff and say, oh, why haven't you done your whatever training, or manually ask every child for their personalized action plan, etc. But it's more so about just having someone keep everyone on track, and understanding, what gaps there are that still need to be identified. Anyone can be the asthma champion. It doesn't need to be a specific role, and I think we're really keen to have it so that all staff feel like they take that they have a part to play in the um, in making their school asthma friendly. Um, I put on here some example key responsibilities, but it is entirely up to you and your school and how you want to run things. But I would imagine, it'd be something like just keeping the documentation up to date, and checking expiry, and notifying parents if they need to send in a new inhaler, checking that the emergency inhaler kits actually have emergency inhalers in them, which is always a good thing, as well as knowing where everyone, making sure that everyone knows where everything is, and what to do when you're not sure if someone's asthma is well looked after. And then the next part of that is having a good register. Um, the register, I'm sure you're all very familiar with registers. However, what we want to have with this register is a useful document that anyone in the school can refer back to, and quickly find out, say in the case of an emergency, what the parental consent status is, if they've got any specific triggers, if they've got a personalized action plan, and so on and so forth. So what we want is it to be a kind of digitally accessible, or otherwise easy to find document that is updated regularly, and in line, data should be stored in line with your school's information governance policy, but it should have enough details that whoever is there can confidently look at it and identify who is having issues in an emergency, and then sort out the appropriate actions from there. And one of the other reasons why we request that a personalized asthma action plan comes with the children and is stored with our register is that evidence shows that it's really quite good, in that there's about a 30% lower chance of hospital admission when you have a personalized action plan that's followed. And then kind of leading into that, when we talk about managing asthma at school, I mean, there's two sides to it, right? There's the day-to-day routine stuff, and then there's the emergency stuff. And I think one of the key areas that we want to do is we want to have robust emergency management, But I think what we also really is important to us and preventing people from getting to hospital is making sure that our pupils have good habits in the management of their day-to-day asthma. So ideally, for most um, regimens of inhalers, it'll be about twice a day, one in the morning, one at night. So most children shouldn't have to take it at school. And so this shouldn't be a huge, um, monitoring exercise for staff at the school. But if a child does feel like they have to use an inhaler at school, whether that's a reliever inhaler or a preventer inhaler, because they missed it in the morning, we ask that, that children feel comfortable to flag that to a member of staff, which will lead into part of our training, and that it's recorded so that there's a system in place to identify if children are having worse asthma management at school, and a kind of means to identify this and let parents know. Um, as we said before, it's also good for personalized asthma action plans and a school asthma card to be provided as well. We, if you're not familiar with these, as Liz says, they are really, really useful. They just outline, they're quite quick to complete, and they outline what the triggers are, what the normal steps of escalation are, and what you need to do in that moment for the symptoms that you've got. And so it's useful not only for the pupil but for the staff to have in a time of minor worsening of asthma, or if it gets significantly worse, what to do then. And it's something that's usually developed with your GP or your asthma nurse. So I'm not going to ask you to start writing them for your pupils, but what it would be good is that if you request these from the parents, and if they don't, um, if they don't have one, to gently push them towards having that discussion with their GP and so on, to get one sorted, because I think it makes a big difference. It's a 30-minute investment of their time for the appointment, but it makes, if in the case of an emergency, it makes a huge difference. And the final thing really is about having access to medications. So we normally say that we want children to be able to have their inhalers on them as much as possible, carry it themselves as much as possible, and feel confident in managing their own asthma. But we recognize that it's not always possible, and sometimes you have to look after the inhalers yourself. You have to store them with the medical stuff in the school. But so we have put a bit of a caveat on, accessibility to medication if needed. But as Liz said, everyone, including a teenager, should be using a spacer, because I think it drastically improves the amount of medication that reaches the lungs. I think it's about double. Correct me if I'm wrong, Liz. And it makes a huge difference. So we've just put in some provisions about encouraging spacer use and safe and appropriate storage. However, we suggest that as many people as possible carry their own and manage their own asthma. So hopefully that's not too much of a burden on staff in the day to day. But alongside that, and is the emergency stuff. Now, the main thing that we've requested in this is to have the existence of emergency asthma kits. You might already have these on site, you might not have them. Regardless of whether or not you choose to go through with the whole of the accreditation process, I think this is probably the number one thing that you can get in your own for your own school. An emergency asthma inhaler kit is, as it sounds, a generic inhaler that is usually salbutamol, which is a reliever. So it's the blue inhaler that immediately opens up the airways in an emergency. Um, and normally that should contain the inhaler, it should contain a spacer, and it should contain some instructions for use. a checklist to make sure, or a kind of procedure to make sure that you know what you're doing, and a record sheet for how much it's been used. They last quite a long time. They last about 200 puffs. Say in emergency at the high end, you're going to use about 10 puffs. It's at least 20 uses, and it should be quite it's quite cost efficient for that purpose. Um, and there might be a questions that some people may have about buying these inhalers. So unfortunately, we won't be able to provide the funds to buy these inhalers for schools, but we are trying to lower the cost by providing free training and free physical resources otherwise. Um, However, schools can legally now purchase emergency inhalers from pharmacies without a prescription for the explicit use in asthma emergencies. Um, as I mentioned earlier, we have provided the template written to follow the legal guidance and request to pharmacies, and in that we've also put in a record sheet for the emergency inhaler usage to kind of minimize that paperwork burden for you guys as much as possible. Um, the other thing to note is that sometimes you will see brands that, specific brands like Ventolin or Salamol or whatever. But what we've written in our letter is the generic name for the drug, which is salbutamol. And the reason we do that is because the pharmacy can then pick the lowest priced generic version rather than the markup that you pay for the branded versions. So that's just the kind of logic behind this. Again, I really encourage if you're going through the process of getting this to go through the whole process of accrediting for an asthma-friendly school. But if there's one thing to take away from this, I really suggest that your school has at least one, but ideally three emergency kits available on site. They're cheap, they're effective, and they prevent people from going to hospital. And then the kind of final bit really to this accreditation is making sure that everyone in the staff cohort is trained up. It's not going to be an intensive training, we're not going to ask anyone to start running A&E and put people on oxygen and stuff like that, but rather it's more an awareness of what the asthma management actually is. The number one issue with asthma in from a doctor's point of view is inhaler technique. So we always find that people understand the regimens, they do it often, and they do it they follow the doctor's instructions that front, but so much variability exists even in adults on the way that people put the inhaler to their mouths, they press the button, how they breathe in, whether or not it gets stuck on the cheeks instead of making it into the lungs. And so it's really important, if that's the case for adults, for children, it can be even more difficult to get that consistency. And so it's really important that, as staff who children see for, 8 hours a day or so, that they that you understand when good practice is happening, when bad practice is happening. You understand what's setting things off, and you understand how to help people through asthma from a big picture point of view of their health and their social well-being, the ability to engage in sport and other activities with their friends, as well as the medical stuff on emergencies and medication use. So we are trying to provide free online training with the NHS, Bedfordshire, Luton, Milton Keynes. Um, it's only 50 minutes long. It doesn't take very long, and I think it's very well received by everyone who's done it. It should. Our goal is to have every member of staff who will encounter pupils trained to at least an 85% score on the training. Of course, if you've got an alternative training provider or your school has already done this, we will happily recognize that as an equivalent. Um, but the important part for this is that we get as much knowledge out across the school as possible so that in any situation, no one feels uncomfortable helping a student with asthma. I think that's also important to highlight that we really want, PE teachers and sports staff to be aware of the training and engage with it because, maybe it's different nowadays, but when I was a child, certainly, I felt that I couldn't take a part in as much sport as I can, as I could, living in Glasgow with the cold being one of my triggers for my childhood, undiagnosed, mind you, childhood asthma. And I think it really makes a big impact to your well-being as a child. So I really want that to, from a personal point of view and from a program point of view, to encompass all staff as much as we can, including sports and PE staff. Now, that's a rundown of the details of the program. There'll be a bit more detail on our website, but I'll just give you a quick run through on the resource so you know what you're looking for. But what we'll do is I'll post this link in the chat. It's to our Luton Family Hubs website. So if you're not aware, we also have the Family Hubs in Luton. Physically, it's located at Luton Central Library on the ground floor. And it's a great place for, as the name suggests, families to engage, get together, get support socially or from the council. They've really been very helpful in setting up some of the stuff with us in Luton for the Asthma Friendly Schools program. So what I'm going to do is I'm going to open that web page and share my screen, and we can run through the exact documents, kind of where things sit, and then how to submit the form. Um, but you can either use that link, which I'll post in the chat, or you can use the QR code. Right, so hopefully you can see my full screen now, not just the PowerPoint. Um, but in essence, this is our Family Hub's website. It's available as a desktop browser kind of website, but you can also install it as an app on the on your phone and your mobile. Um, it's familyhubs.luton.gov.uk, and you can find the asthma friendly schools under this. So the way that you find it is you just scroll down to the health and well-being section. And within that, we have a general asthma page, which provides information on asthma. But in addition to that, we have our asthma friendly schools page, which should have all the dedicated resources and it sits under the health and well-being tab. So in this, we'll make some design changes because it's a bit wordy at the moment, but we'll make some design changes so it's a bit easier to read. However, fundamentally, all the information that you need should be on this page. It details asthma-friendly schools, details the key bits about asthma, and what the kind of reasoning was, as we've seen today, as well as what you receive. Here's a nice example of Stopsley High School's certificate, copyrighted, mind you, so you can't steal that one. But as well as a walkthrough on the process to do it. And then we've also provided all of the examples here. So if you want to see the checklist, that's a paper checklist that you can print out and see every single criterion. You can do that from here. If you want to see the kind of request letter and how to use each template. For example, this is the pharmacy letter. You can find it from here as well, and then get some documentation for your own records if you want, and so on and so forth. We've got our big policy documents, which you may need to tailor for your specific school, but this should give a brief rundown on the kind of save you a lot of the paperwork on what is asthma, how to recognize asthma, the general types of medications you might see, who's the asthma champion, what the responsibilities are, what to do, and where things may be stored, emergency kit procedures, blah blah blah. The drill. So we're hoping that we've helped provide a lot of resources and help cut down on the legwork required. And then when you feel ready that you've achieved everything on that checklist, you can do the self-evaluation yourself. So on our link here, as you can see, if you scroll down to the middle, there's a self-evaluation form link. And if you click this, it will open up the Luton Council web form. And then I'm going to skip this because I've read it, but you can read it in your own time. You fill in all of these. We'll just put in some details here. Sorry, the school will be called A. And then it requests the checklist, which you can see as I showed earlier, a table format for your own printing and checking off. And then you can answer all of these questions and so on and so forth. If you answer no or it doesn't meet the criteria for any reason, you will not be able to submit. So once you've answered yes to everything, sorry, you're going to have to wait for 2 seconds for me to do that. When you've answered everything, now you can click submit. So, oh, I haven't answered everything. Well, there you go. Now you can click submit, and then once you have submitted, you can you will receive a email with the certificates. Now, unfortunately, I didn't put a real email in, so I won't be able to see the certificate. But it's very quick and it's very simple to get all of the forms and certificates this way. So, as I said before, it's a trust-based self-evaluation form, but we will audit it regularly, and this may include some in-person auditing. So, as much as you can, please be truthful and try to keep things upkept as after the accreditation for the ease of auditing, let's say. And then alongside that, we also have our email here so that you can find it there, but it's quite simple to remember. It's asthmafriendlyschools@luton.gov.uk. And then we have some other links which will populate as we build a few more resources in. We'll populate on here, and we'll try to, cut down on as much paperwork as we can for you guys. What's not on here are the resources for the school banners and the training request. So again, if you would like to request those, I highly suggest that you email and we will try our best to get those sorted out for you as quick as possible. So that's a quick rundown of Asthma Friendly Schools. I know it's a lot of talking and a lot of reading and a lot of criterion, but I think the take-home message from me is that you might already be doing a lot of the work. Even if you haven't, it shouldn't take a huge amount of time to do the work. And we are trying our best to make it as easy as possible, whether that's from an administrative point of view or from a resources point of view. And any questions, or any queries, any specific things you want to ask or request for, email us and we can see what we can do. I think that'll be it from me. We'll take further questions after near the end, but if you do have specific questions, please pop them in the chat. So I'm going to pass on to my colleague Izzy Malik, who is one of the public health officers who has been a great help in the programme.
Thanks, Ray, for the introduction. So my name is Izzy and I am a public health officer and I work on the tobacco control agenda. So I'm here to talk today about our Protecting Little Lungs campaign. So some of you might have already heard of this, but yeah, I'll give a quick rundown again. So just to set the scene, so back in 2023, we published a new tobacco strategy, which is currently in place up until 2028. And basically our vision is to create a smoke-free or tobacco-free Luton where anybody that lives in Luton does not have to suffer from the harms of tobacco, regardless of their age, and help them live healthier, longer lives. And the Protecting Little Lungs project is is just like a small part in our wider tobacco-free Luton agenda. Now, once every quarter, we meet, online just to discuss some projects and potential for, partnership and collaboration. So if at any point you are interested in joining our membership, please do get in touch. Okay, so the impact of secondhand smoking. So the Protecting Little Lungs project is basically a campaign which kind of destigmatizes the harms of secondhand smoking and encourages parents and caregivers to give up smoking because of the impact that it has on children and young people. So we know that secondhand smoking increases the risk of glue ear, and in the UK we have 120,000 new cases of middle ear disease every year. Again, we've got asthma here, and that's at least 22,000 new cases in the UK alone. It increases the risk of respiratory disorders, including emphysema in later life, and over 20,000 cases are attributed to lower respiratory tract infections. We have 200 cases of bacterial meningitis and 40 sudden infant deaths, which is 1 in 5 of all SIDS, all because of the harms of secondhand smoke on children and young people. So we can see there is a huge impact from smoking, and I think it was mentioned earlier in one of the first presentations that smoking the smoke is a trigger of asthma as well. So hence the importance of kind of combining this in the presentation and what we're presenting on today. So what does the law currently say? So on the 1st of October in 2015, it became illegal to smoke in a private vehicle carrying passengers under the age of 18. However, there's currently no laws to protect children from the secondhand smoke in their homes, which unfortunately means that it makes it a lot more difficult to enforce, recommendations or, guidance, because it's ultimately, it's not against the law. So just to set some context around some statistics in Luton. So the most recent Luton health survey showed that 19% of pupils responded that their parents and carers smoke cigarettes. 6% of pupils responded that someone smokes indoors at home in the rooms that they use, and 8% of pupils responded that someone smokes in a car when they are in it too. So these are quite important statistics, because it still shows that regardless of the laws that are currently in place, there is still smoking around children and young people, and it's our duty to try and raise awareness on the harms of the secondhand smoke. So what can we do? So if parents or caregivers are unable to or unwilling to stop smoking, the next best thing that we can do is at least create smoke-free environments, and some of those include outdoor environments. That could be the school gates, it could be shopping centres, could be smoke-free parks. But I suppose that's something that we can do to deter parents and caregivers to not smoke in those areas. Simply opening a window doesn't help. Smoke can still linger for up to 2.5 hours after the cigarette is put out. So education is key, because opening a window alone is not enough to get rid of the smoke. And several studies show counselling, motivational interviewing and advisor-led stopping smoking is in a clinical setting one most effective. And it suggests that population level health campaigns are needed to change behaviour. So this is what our campaign is all about. So our current campaign, Protecting Little Lungs, it aims to support schools to make their entrances and gates smoke-free. So what we do is we provide a banner for schools to display at their entrances. The aim is to discourage parents and caregivers from smoking when dropping or collecting children. We have had schools say that it is a major problem. They still see parents smoke and vape at school gates, and this behavior, that role modeling behavior, it could suggest, show children that it's okay to do that. So there is that element of learned behavior which we want to try and eliminate. And the last thing is to support teachers and parents or caregivers to quit smoking via easier access to Luton Stop Smoking service. So we are very lucky to have a specialist stop smoking service, Total Wellbeing Luton, and yeah, it's all free for anyone over the age of 16 in Luton who would like to quit smoking. So the objectives of our campaign is to engage with and support schools in creating smoke-free areas around the school gates, provide resources and training to encourage conversations with parents. We often find that sometimes, there may be parents smoking at the school gates, but staff are probably not as confident in handling those conversations or how to start healthy conversations. So that's something we are willing to support with, and I would deliver bespoke training if that's something you would be interested in. We would like to make smoking less visible and to reduce that exposure to secondhand smoke, reducing children's exposure to adult smoking, and therefore reducing influence. We'd like to help denormalize smoking, so really encouraging children to learn about the harms of smoking, just to kind of just encourage that thinking that smoking is not okay, there are harms, long-term harms, and kind of spin that. And then lastly is supporting parents and caregivers to quit smoking. And what we are trying to ultimately achieve is to reduce smoking rates amongst adults in Luton, including school staff and parents, increase the number of referrals to our Stop Smoking service, increase the awareness of secondhand smoke. Ultimately, we would like to eradicate smoking outside of primary school entrances and early years settings. The reduction of cigarette litter outside primary schools, and ultimately a reduction in asthma-related absences, because we know, smoke can tobacco smoke can trigger asthma episodes, and like to reduce that as well. So what do schools need to do? It's very simple. So we would just like you to display a banner at each of your entrances. We have got display posters available that you can put around the schools, and it's just got very quick, easy facts on the harms of smoking, and just raising awareness of our local Stop Smoking service and how to access stop smoking support, and have healthy conversations with parents and anyone within the school grounds. And training is provided if you feel like you don't have the skills to strike up those conversations, because it can be quite nerve-wracking. You're not sure how a parent might respond to that if you say, oh, you shouldn't be smoking, but there's ways, tactful ways you can start that conversation, and literally a quick encounter can encourage a parent to think about contacting their local service. So you might have heard of making every contact count. So I deliver bespoke training, and if that's something you'd be interested in, please do get in touch. So this is what the banner looks like. So this was designed for early year settings and primary schools. So we are offering a free banner or banners to your setting. So all you need to do is get in touch with me, or just say I'd like a banner, and then we'll just kind of have it printed and delivered. We have had some delivered and printed across Luton already. So these are some of the ones that have been installed. There were others, but I didn't have pictures of them. So yeah, they're quite bright, visual, and it's a friendly reminder to parents to, not smoke or vape outside the school gates. So these are some of our posters that we've got. So you can see it's just nice, engaging, bright. It can, quite pleasing to the eye. And, hopefully some of those statistics and facts on there will just encourage parents, anyone to, think about quitting. And it's also got information at the bottom of the leaflet on how to, sign up to support as well. The website, the quit code, just to kind of encourage any parent to think about the next steps and why it would be good to quit. And then, any further information you'd like, please do get in contact. And like I said, we have got training available to professionals. We can offer bespoke MEC training, and signposting information is also available. You can contact the public health email address, or alternatively, you can just, take my email address down. And if there's anything that I can support you with, or if there's anything else that you'd like to discuss, or any support within the school that you would like, feel free to reach out, because that's what I'm here for. And I'd be more than happy to help. So I think that's the end of my presentation. So happy to take any questions if there are any.
Okay, so hello everybody, good afternoon. My name is Mandy Gatenby, and I am the head of PSHCE at Stopsley High School. We have worked really closely with Tara Lewis at Luton Public Health in order to achieve the Asthma Champion Award, which we feel has been really invaluable to our setting. So today I'm just here to give you a brief overview of some of the steps that we took within our journey to successfully achieve the Asthma Champion accreditation. Okay, so we were first introduced to the Asthma Champion accreditation during the borough-wide PSHCE primary and secondary school meeting, which was hosted by Tara at Luton Public Health. The scheme really did resonate within our setting. We currently have 72 students who are known to have asthma, and also the evidence that was provided by Tara and that you spoke about earlier, Raymond, regarding the number of hospital admissions across Luton, specifically the 52 out of 70 schools that had at least one student with asthma attend A&E over that winter period. Alongside that, the children in Luton that are up to 6 times more likely to be hospitalised due to asthma than the average child in the UK. So as a setting, we felt that we really did have a role to play in ensuring that students that are within our asthma register and their families had the tools in order to manage their condition, and as well as that, upskilling staff to be able to recognise the symptoms and be able to react accordingly while within our community. So we approached the accreditation at the start with a little bit of apprehension. However, Tara was really helpful and really supportive throughout the process that we sort of went through to achieve the accreditation. We were provided with a set of standards in order to establish our current context and where we were. And then once this was known, we were then able, with relative ease, to map the adaptations required to our current practice, and then begin to timeline in order to introduce the standards that hadn't quite yet been achieved or were not evident. So we quickly established that to assist us in tracking the changes and to ensure that the standards themselves were met in a timely manner, a working document to support us with that would be required. So this took the form of a spreadsheet, which you may be sitting there thinking it's not particularly remarkable. However, this was really pivotal to us because it promoted a really collaborative approach, particularly within our large secondary setting. For example, this meant that with relative ease, members of the working party, which was our business manager, myself, senior leaders, our medical officer, staff, both teaching and non-teaching, and also with Tara at Public Health, were able to track the changes to ensure consistency in the application and also the messaging, and making sure that messaging was correct within our school community. So I thought it would be useful to outline some of the areas that we hadn't quite met or weren't yet evident, and where a collaborative approach was really crucial in order to meet those standards. So we created a school asthma policy, and this was created by our working party. That was then reviewed by our governors, and then is shared with parents across multiple communication platforms, including our website. We updated our school signage to remind all in the school community and beyond of no smoking and vaping outside of our school gates and also within our school building. The marketing team themselves were really pivotal in that because they helped to design that signage and signpost to parents in our weekly newsletter with the to regularly, update us of keeping the medical office aware of any changes to students that had asthma plans. We created a register, an asthma register, and this is now sent out to all of our staff every half term. This was produced via our internal MIS system based on the information received from all of our stakeholders and then triangulated by our medical officer. Our staff asthma training took place, and that took place during an inset day. In order to support us to achieve, in order to ensure that all staff completed the training in a timely fashion, this therefore had to be worked into our directed time. And the senior leadership team were really on board and really supported us with that aspect, and that was particularly pivotal. A survey was also sent to parents to create individual asthma plans. We collaborated with our IT team and also members of the senior leadership team to find out the most efficient way to create that survey, and that would generate our live database that was easily compatible with our MIS system. This was really invaluable because it has resulted in each child having their own unique and individualised approach to the management of their asthma. So the Asthma Champion and how it really has helped our school has been really key to us. For this, it has been really fivefold. So we now have a much higher awareness and therefore also confidence for staff when we are supporting students with asthma. The training itself has supported staff to recognise the symptoms associated with asthma and to be able to react accordingly. Support and advice has been given to students with asthma or those with suspected respiratory problems. An example of this that I can give you, and being a PE teacher myself, it has really enabled me to be able to look out for the signs and symptoms of asthma, and also to support students by supporting them and giving them advice on the next steps should they feel that they need this. So that might be to discuss with their parents and guardians, for me to speak to our medical officer, for them to visit their GP. The asthma register has provided another layer of vigilance when taking students out on extracurricular activities, and our school community is now more aware of the appropriate behaviours also at the school gates. So that's just a really brief overview of how we went about achieving the accreditation. And thank you very much for allowing me the opportunity to speak today. I hope what I've said has been a little bit useful for some of you. And I've also included my email there at the bottom because I'm more than happy to support any schools or anybody thinking to take up the accreditation in sort of any way I can, and to support or advise about kind of areas that we kind of the way that we approach things. So I'm happy to open up for any questions to anybody that they may have.